Hello everyone, my name is Jade, and I will be the voice of the presentation for today. So what exactly is Alzheimer's disease? According to National Institute on Aging, World Health Organization, Alzheimer's Society, Alzheimer's is a common slow-acting neurological disease and a form of dementia that affects mostly people aged 65 and older. It results in a widespread damage in the brain due to neuron malfunction and neuron death. Now let us explore what occurs in the brain with Alzheimer's disease. What are amyloid beta plaques? According to National Institute on Aging, a protein in brain cells called amyloid precursor protein is broken down into toxic beta amyloid molecules. These molecules clump together outside neurons, forming plaques that interfere with normal brain function. What are neurofibrillary tangles? According to the National Institute on Aging, neurofibrillary tangles are twisted clumps of a protein called tau that clump together inside brain cells. In Alzheimer's disease, these tangles interrupt the cell's transport system, preventing brain cells from communicating properly and resulting in memory loss. According to the National Institute on Aging, with a buildup of plugs and tangles, neurons become damaged and die. This causes the brain to shrink, which is also called atrophy, leading to problems with thinking, memory, and decision-making. This is the difference between a normal brain and a brain with Alzheimer's. What are the signs and symptoms for Alzheimer's disease? According to National Institute on Aging, here are the following key signs. The first one is cognitive changes. Planning, judgment, and problem-solving skills are impaired. They may have difficulty with even simple tasks such as reading recipes or balancing their finances. They frequently turn disoriented, unable to remember what time or place it is. The second one is language issues. Communication becomes difficult with word-finding problems and difficulty tracking conversations. Others may ask the same questions over and over or make up new words. The third one is sleep disturbances. Many develop substantial changes in their sleeping patterns, such as insomnia and sundowning, which is the heightened confusion and agitation in the evening. They might also struggle to tell the difference between day and night. The fourth one is memory loss. Problems with short-term memory tend to be one of the first visible signs. Individuals struggle to recall recent conversations and recognize familiar faces and places. Some people may suffer from delusions or hallucinations. They may become wary of other people or develop fears for their safety. The final one is behavioral changes. Common are personality changes such as anxiety or withdrawal from social activities. The topics we will discuss regarding the etiology of Alzheimer's disease are supported by research from Brege and Karam in 2020. Etiology, predisposing factors, and risk factors. Aging is the most important risk factor of Alzheimer's due to age-related changes occurring in our body. One is atrophy, known as shrinking of cells. This affects certain areas of the brain, causing a decrease in neurons, affecting the connection between cells, brain inflammation, vascular damage, and the breakdown of energy production within cells. Since these changes also occur in normal aging, it can be difficult to distinguish Alzheimer's in its early stages. Genetic factors also play a significant role in the development of Alzheimer's disease, making 70% of the cases related to it. This is mostly the cause of early onset Alzheimer's disease, as they inherited the autosomal dominant pattern and mutations in the dominant genes, such as amyloid precursor protein, which is responsible for the abnormal accumulation of amyloid beta proteins. Alzheimer's disease is not solely caused by aging and genetic risk factors. Environmental factors also play a role in its development. These include air pollution, diet, exposure to metals, and infections. Diets that are high in saturated fat and high calorie intake have been recognized as risk factors for Alzheimer's disease. These kinds of diets can degrade heat-sensitive micronutrients that can cause excessive loss of water and promote the formation of toxic byproducts. These effects lead to oxidative stress, inflammation of cell surface receptors and proteins, leading to cognitive decline and the progression of Alzheimer's disease. Additionally, a deficiency of certain vitamins like folate, vitamin B12, and vitamin D are shown to increase the risk of developing the disease. Cardiovascular disease are significant risk factors for Alzheimer's. Stroke as well, for example, increases the risk of Alzheimer's due to the loss of neural tissue, which enhances degenerative effects along with influencing the pathology of two proteins, amyloid and tau. Heart failure also plays a role by weakening the heart's ability to pump blood efficiently, leading to reduced blood flow to the brain and neural damage. Obesity is also linked to low blood flow to the brain, which contributes to memory loss, vascular dementia, and brain inflammation. Obesity is also a risk factor for diabetes type 2, cardiovascular disease, and certain types of cancers, which all have links to the increased risk for Alzheimer's. Brain inflammation, a common consequence of obesity, triggers an increase in microglia, also known as immune cells, resulting in disrupted neural network connections and slows the formation of new neurons. This causes alteration in insulin action, resulting in accumulation of amyloid beta protein and reduced tau protein degradation, which is associated in Alzheimer's. According to National Institutes of Health, although there is currently no way to prevent Alzheimer's disease, here are some lifestyle changes that may help. Controlling of high blood pressure, managing blood sugar, maintaining healthy weight, staying active, taking care of overall health, preventing head injury, drinking less alcohol, and stopping tobacco use. Diagnosing Alzheimer's disease is a complex process, according to Mayo Clinic, as many other conditions share similar symptoms. For this reason, multiple testings are required to rule out other causes and confirm a diagnosis. We will break down the reason for the following tests that I have mentioned in the process of diagnosis. Physical exams are important for ruling out other health concerns associated with cognitive or behavioral changes, like a stroke or Parkinson's disease. Interviewing family and friends who are familiar with your daily life may be able to report cognitive changes with problem-solving, decision-making, behavioral changes with personality, forgetfulness, confusion, or difficulties completing activities. These interviews will provide information for your doctor to determine the progression of cognitive decline. Mental status test determines one's cognitive functions by providing common questions that can evaluate any cognitive impairment. These questions may try to get patients to remember specific details, such as where they are, the time, the date, or to recognize certain objects. Laboratory tests rule out low B12 or a low-acting thyroid can mimic symptoms similar to Alzheimer's, like memory impairment, depression, and fatigue. Cerebrospinal fluid tests allow collection of spinal fluid samples by using a spinal tap. This lets us see the levels of amyloid and tau protein, which are essential in Alzheimer's development. Brain image tests rule out brain injury that mimic Alzheimer's symptoms. MRIs check for brain shrinkage. CTs check for signs of brain damage from brain injury. And PETs detect reduced brain activity along with buildup of amyloid plaques or tau tangles. A buildup of amyloid plaques, tau tangles, and reduced brain activity may indicate Alzheimer's. What are the following treatments for Alzheimer's disease? According to Alzheimer's Association, there is currently no cure for Alzheimer's disease, but on a positive note, the symptoms that arise with this disease can be managed effectively and improve the patient's quality of life. Cleveland Clinic reports a two-point approach to treatment that supports the use of FDA-approved medications involving the use of cholinesterase inhibitors and memantine, whose main functions are to primarily protect the functions in our brain. Secondly, our focus will be on non-medicated strategies that include changes in the patient's lifestyle and helpful ways to improve their well-being. The first type of medication we will discuss is cholinesterase inhibitors. According to the Mayo Clinic and the National Institute on Aging, this medication helps acetylcholine, a chemical in the brain essential for learning and memory, to stay active for a longer period of time. The first medication is donepezil. According to the Mayo Clinic and the National Institute on Aging, this medication is effective across all stages of Alzheimer's disease, making it a valuable treatment option. The second medication is rivastigmine, which according to Mayo Clinic and National Institute on Aging works for mild to moderate stages for Alzheimer's. The National Institute on Aging also explains that this medication targets enzymes that break down acetylcholine, a chemical important for memory and learning. The third medication is galantamine, which according to the Cleveland Clinic and the National Institute on Aging is used for the mild to moderate stages of Alzheimer's. This medication assists the brain by releasing more of the chemical acetylcholine. Secondly, there's memantine, which according to the Mayo Clinic and the National Institute on Aging is used in the moderate to severe stages of Alzheimer's disease. The National Institute on Aging adds that this medication is often combined with donepezil and works to regulate glutamate, a chemical in the brain that according to the Cleveland Clinic plays a crucial role in memory and learning. According to Alzheimer's Society, holistic approach to care is similar in importance to medications when it comes to managing Alzheimer's disease. According to the Alzheimer's Society, engaging in memory exercises like puzzles provides a mental stimulation and helps keep the brain active. Social interactions is also crucial as they offer vital support in reducing loneliness and isolation. Changes in lifestyle makes a huge difference as well. According to the National Institute on Aging, incorporating a Mediterranean diet consisting of foods such as fresh vegetables, nuts, and fish promotes brain health. Alzheimer's progression, what to expect over time. In the early stage, which can last up to 2 years, the Alzheimer's Society states that memory loss remains mild, and individuals can still live independently. However, National Institutes of Health emphasizes that this is the best time to begin treatments and plan for future care. During the middle stage, which can last for several years, cognitive decline becomes more pronounced. The Mayo Clinic reports that individuals often require increasing assistance with daily tasks. Mood swings and behavioral changes also emerge, making daily life more challenging. The later stage, Alzheimer's severely impacts communication and mobility, requiring full-time care. The Mayo Clinic highlights that individuals may struggle to move, speak, or recognize loved ones, while the Alzheimer's Society stresses that the focus should be on comfort and dignity. Understanding Alzheimer's prognosis. According to the Mayo Clinic, the average life expectancy after an Alzheimer's diagnosis is between 3 to 11 years. However, the Alzheimer's Society and the Mayo Clinic report that some individuals may survive up to 15 or even 20 years. Jennings and colleagues, on the other hand, highlights the importance of quality of care in managing risk factors and preventing complications, which can improve overall health outcomes. The Mayo Clinic further explains that cognitive impairment and other existing health conditions at the time of diagnosis play a significant role in determining life expectancy. In the final stage of Alzheimer's, the Mayo Clinic highlights that difficulty swallowing raises the risk of pneumonia, a leading cause of death. The Alzheimer's Society and Mayo Clinic also report that immobility-related complications worsen health decline. Additionally, the Alzheimer's Association mentions that advanced care planning ensures patients receive proper support. Advances in hope for Alzheimer's care. The recent advancements in Alzheimer's research are bringing us much closer to effective treatments. According to the National Institute on Aging, new medications like lecanemab and donanemab target harmful amyloid proteins in the brain that helps to slow the progression of the disease. Additionally, Valayukas and colleagues report that immunotherapy is designed to protect brain cells from further damage and is showing progress as a potential treatment option. Thank you so much for watching our presentation. We hope you found it informative and enjoyed the video.